do is real estate development. So
Well, we'll call them. People hear me now? Okay. First on the agenda is roll call by county. Shoshone County,
Here.
Cooney County,
Here.
Bonner County, Boundary County, here. Benoit County, here. So we have a quorum. Next is welcome remarks by Thomas Fletcher. It's the PhD director, but he's actually chairman of the Panhandle board. Is he here? Looks like he's not here, so move down to this is the proposed presentation by Eric Kelton. Getting there?
Thank you, Chairman. I just have a couple of brief comments. I'm not going to go into detail on the budget that has been presented to each of the county commissioners. We do continue to see strong use of our environmental service programs, septic permitting, food inspections. We also see strong use in the WIC program and the home visiting programs. What I would like to touch on changes in the budget are two items, or I guess one item specifically. In the last several days, talking to a number of county commissioners, it became clear that there were aspects of the budget, specifically some infrastructure improvements here in the Hayden building that were not appropriate to address at this time because we recognize that there are funding challenges at the county level. And in respect to that, we removed those items from the budget, which was in the amount of $280,000. That did have an impact to each of the county's contributions. I did share that with each of the commissions. So you have that information. The other issue that was expressed to me with concern was our clinical services. I want to share that I think that that's an important issue. I think it deserves discussion. Our clinical services are at a minimum right now, which is clear. And I know there are concerns that adequate services are being provided to all counties. What I want to emphasize is that we have consistently provided services to all counties historically. There have been reductions in recent months due to staff turnover and the need to fill some positions, but we do expect that we will have those staffing positions up to speed where we'll have services to all counties. Now, that being said, I recognize that the board is having an important discussion with the future of clinical services. And I believe that it's important to continue to take a look at that. We have another meeting scheduled in August for the board to future consider what role, if any, or what complementary role we should play in regards to federally qualified health centers, such as Kinixu Clinic. My expectation is that when we have that robust conversation and we determine where we can best fit in that role, then we will take a look at the budget and we will make adjustments as appropriate and have those discussions with the board and with county commissioners. So that is my commitment on that. With any questions that I can answer at this time? Okay, thank you.
Next on the agenda is budget proposal that is stated on the board up there. We have a motion to approve the 2026 budget. Get a second? Is there any further discussion?
Overhaul and shift to Water County's concern has to be with clinical services. Part from the perspective of what Water County does is actually we don't have a high use of this service in Water County. We agree with one clinic rate for use of capability. We see a significant reduction in that. We are actively seeing more use of outsourcing that are used for to also charity health. The other concern for Water County is our utilize but making sure that people also equally recognizing that there is time and commitment so that we're just sharing the community and having help to work with those places like quality so with that that's the that water science starts to do also recognizing that water science there is a sport that we do a better job of communicating with the water science and the desire that person and with an expectation or things that happen we have a first meeting with our board members with a request that we come to water science coordination and the representation and that's something we can provide through communication. So it's in no part as we're doing kind of there's at that meeting to and I do I want our budget one of our businesses is PO having to draw down the issues all the companies initially those are done with the design of the have got
Chairman? Yes. First of all, it is true. Eric is very responsive and listens and seeks feedback from all of us. And that is probably one of the best qualities you could ask for of the commission. So thank you. With respect to Commissioner Williams' comments, duly noted. But as you know, we have a lot of changes going on in Washington, D.C. A lot of uncertainty. Even today, in the quarterly press, there was two groups of people discussing cutbacks on federal funds. The health districts were not created in a vacuum. There's a reason behind why we are here. And so the concerns that Commissioner Williams brings up for Bonner County are certainly things that we should be addressing. But I would say at this point in time, let's get a better sense as to what the future holds for this community, for this district, before we start making big changes on infrastructure. Because anyone who's ever gone through the process of expanding infrastructure, you can't just expand it and contract it at will. It takes time, it takes resources, and it requires lowering staff levels. You can't find those people very easily, especially in this market. So just a little bit of prudence, a little bit of where we're going to land long term, I think would be appropriate.
Are there any other comments?
Yeah, I'll make a comment. I visited with staff with them, and with the reduction, it could be get these people. In fact, our citizens have to come and put it in the because they have to come to your town. And then I went over and visited with Conexia, and then with other people to the point where if you're a patient of Conexia, they can get you right in. If you're not a patient, then you're going to have to take a phone, and they're out 10 days. So I'm thinking to have clinics and requires chemicals, and if anything, if we had consistency, we didn't have too much consistency, and that's what we're going to have lost. We have it like every Wednesday, or we have consistency with people, and they do it, and that was lost. And so, again, I would say either
So our services we don't have this. So it's not unreasonable to say the way healthcare works for people with health insurance is once you have established treatment, you get when you're doing so the idea that says that clinical services come out with it's not existent in that county. When you look at the metrics that built up for the bottom line, it's not that the insurance part county, this has already been. And Bonner County recognizes that budget will move forward, so there is no, and so we recognize it's going forward. This is the point that we were talking about what our needs are for our community, because you guys saying that you should rely on the county, well, then you're in the same situation, Bonner County, in that you have one thing that says services we can have that thing, and waiting to meet the if I don't have a good situation and I call my doctor, I'm gonna have to leave. I have to admit, it isn't a matter of, that the issue is services are there, and we have to, in services. So we're not creating the change by requesting a review of the services. The change has been as a viewpoint to us, and the area that has the biggest use of the services is city county, which is not negligible. No longer county about Hartford County. But when you're saying that the other counties contribute to the park, that is Panhandle, those same counties who, for us, it's over $500,000 to contribute. Well, what could I do with $500,000 in my budget to directly impact water county budget? That doesn't mean that there's not a public health aspect to it. That is also people involved in that. It's that in terms of when we look at the increase in services from Panhandle County, there's a significant decline in the major area that is the services in water county. And so you guys can think that's not Panhandle County. That's a new to it. And so I would say if the isn't whether or not Panhandle County offers services in Clinton County, it's just this water county. That's what the vote is for each county to identify. This is the money that we ask from our county. And so this isn't a traditional agent either. So our board actually sat together as a board and reviewed the budget and we went through what we can. And the question is, over when we look at what we get, it doesn't, we're not getting services pulled from Panhandle County into our neighbors' services, which is the two things. And so in part, there's a need for a lot of counties to we fully recognizing that that's not going to take the options to budget, but we also need to make sure that we need clinical services is something that we're going to have to pay for. We can't get the clinical services in one particular county. Our county needs to be able to do this. So it's not, it is more of a, this, it was an eye opener for our legal to see the budget and to do our due diligence to proactively communicate our concerns and then make a commitment to look at how we want to see things change as we move forward the next fiscal year.
Go ahead, Mr. Chair. I just want to, for a point of clarification, Commissioner, see with this, you said there's a decrease in services. Are you saying that there's less services being offered or there's less services being utilized? I just want to make sure I understand. Okay. So there was a list of services that are offered. You're now getting fewer of those. So Panhandle Health will not offer it in Bonner County. So it might offer in Cleveland. Is that what I'm hearing?
Correct. So like clinical services, whether it's point and offer, we have one lady in our county. That's not, that is a decrease of what it has. And so there's a decrease in services that are accessed. Historically, there was, like Eric said, there was a service utilization, but that has decreased and the availability is decreased.
Okay, sure. So it's I'm sorry. So it's because people are likely using these other services like Heritage Health and not utilizing Panhandle Health, that the number of hours of operation have been coming down from just one day a week.
I think that's a combination of that and the nurse, I think you guys have a nurse that left that particular office, but the number of service hours has decreased also because people have utilized other services. And so for us, if you have to And so you'll see, I work with Dr. Lawson to, for example, one of our APs, mental health therapists, and we've increased about 11 mental health therapists in, Woodson Health. That's providing care that our community needs and providing the resource within the community health system that's outside of that is being actively utilized, which allows them to then, and another comment that was made within our community was, when we increase the services there, then allow them to provide the greater expansion of that particular option.
I think it'd be great just to put together some sort of a proposal, I think, for your county. We could all look at that, because maybe it should be expanded, or, find another way where we can deliver this service that makes economic sense. So,
That's one thing, but the other point of question from our county was, if we have the services that are existing in the community, does it need to be a service offered by Panhandle? That was another question.
But I think the reason, like I said earlier, until we have a sense of the direction of where the funding is going to come from, if Washington changes and says they're going to cut back significantly on the funding, those other places that are offering the service may not be offering in a year or two. I mean, we don't know, right?
I think so the Affordable Care Act allows for health insurance for low-income people. And so you can come out with a zero opportunity there. And so that insurance is available to use outside of Panhandle Health. And so I think there's the idea that Panhandle Health is the only option for clinical services isn't an accurate idea. Now, it may be convenient as people come here for services, and it may be valuable in certain areas, but it isn't the only available option for the class of people that it's being marketed to. There are other options, and I'm not going to. So it's not the only option. It's not totally dependent on. Arguably, the federal funding doesn't change what is happening with people. That hasn't changed.
Yeah, but getting coverage and getting service are not necessarily the same. One. And two, I think that if you have a good idea of what you want to see happen in your county, put together the proposal and lay it out.
This question is about this budget, though. And so when Bonner County is looking at this budget, it looks at what are we being charged with and how is the money being distributed from the county. And so in terms of whether or not Bonner County is being asked to create a budget for Panhandle Health that's inclusive of where do we want to see our percentage go, that's not what this meeting is. This is, we put together a budget, what do the respective counties feel about the budget? And I'm just reporting what Bonner County has commented on the budget. If there's an opportunity for there to be workshops that extend beyond what Panhandle Health traditionally does to include where individual counties want to see their money go, that's up for Panhandle Health to decide. This is just based on the presentation of the budget, what are the respective comments from the county?
I hear you, but your services and budget are directly correlated items. So, if you're saying there's a reduction in services, a reduction in hours in your county, then if you have an idea of what you would like to see, then I would argue make that proposal, and that can be addressed in the budget. With respect to this budget, we're at the 11th hour, so I think we're probably a little bit. The time is coming on for that. But that doesn't mean the money has to be spent. It doesn't mean that we might find out something new in September and then say, hey, now it's the time to shift direction a little bit. But
We need more information.
Yes.
Well, I'm going to give credit for the fact that we did bring forward our issues, and with that, Eric actually made responses that even as this proposal budget, it's less than the budget that every last county received at the very beginning. And so it's absolutely appropriate for Bonner County to voice its issues and concerns to see for potential for reduction. This is not a meeting about what does Bonner County want to see the money go. It's the proposed budget. That's the question.
Sure, correct.
We had issues with the proposed budget, for which Eric did a very good job trying to address the issues that we brought forward that actually result in over a $250,000 reduction of what is in the total budget. So the conversation is a good thing. What I specifically said was, after this, there is no expectation by Bonner County that this budget is not going to pass. But after this, it has shown that Bonner County needs to have a conversation with Panhandle. We recognize that. Also recognize the work that Panhandle Health and Aid responding. Also recognize that our two board members need to proactively and coordinately with that information. Also recognize that for the past few boards, we've been dysfunctional and this hasn't been on our radar. So all of the things that you're saying have been recognized. But it's equally responsible for Bonner County to, in the meeting, when we voice the vote that Bonner County thinks we voted on, is to explain the position. That's all that's happening. With wanting to make very clear and very known that we appreciate the work that Eric put in to address some concerns. And I think everyone around the table should, because had Bonner County not addressed the concerns, you would be pretty voting on a budget that's $200,000+ more than what he was able to recognize, if that would be beneficial to every county.
No, I appreciate Warren County doing that. I agree.
Well, Commissioner Williams, duly noted. So I guess we can go on to the budget question. I'd like to make a comment. Yeah, 2 years, I think it was 2 years ago when the big shift came from the state of Idaho and put more of the budget on the backs of the counties. And now we look at what the feds are going to do moving forward, but we don't know what you're going to do. So we have to just wait and see what's going to happen there. Clinical services are pretty important for Benton County. And we also service about lower half of Shoshone County on the St. Joe River and up Clarkia also. So I know they do use it, and the county actually uses quite a bit of the services from the environmental services in the county. We found some great, on the St. Joe River, we found some places where people put sewage in the river, and that shouldn't happen. We found some really, really poor sewage systems around the county, and they're going to go help us to do that, to clean that mess up. And so, Panhandle Health, does quite a bit. They do inspections for the restaurants and everything. And I feel it's a pretty important part of protecting people's health. Melissa Cowles, do you have any comments?
No, Shoshone County, like the only issue that we had was the carpet, the upgrades, which Eric went over and got rid of off the budget. So we were satisfied with that.
If there's no further questions, we'll call for a vote. And we'll start with you, Commissioner Cowles.
I vote yes to the budget.
How about you, Commissioner from Cleveland County?
Yeah.
How about Commissioner from Bonner County?
Bonner County votes no.
And Commissioner from Boundary County? Commissioner from Benton County votes yes. So that's 4 votes yes and 1 vote no. Motion passes. Next on the agenda is adjournment. A motion to adjourn.
I'll make that motion.
Is there a second?
Second.
All in favor, say aye.
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 Meeting adjourned. Hey, Asia, thank you for your input.
Yeah,
No,
really.
And it wasn't surprised I talked to Eric, it's that we have had the deep conversations on what needs to change in